Hello, I'm Martin Schmaltz, and I'm a personal injury chiropractor located in the Hazelwood, Missouri area of North St. Louis County. As you're aware of, one of the most challenging aspects of personal injury is documenting the nature and the severity of a patient's actual injury. In our office, along with our thorough examination and motion study x-rays, we use industry standard procedures that help us quantify and qualify the severity of the patient's injury and their disability. In this short video, I want to give an overview of these procedures and how they help us substantiate the patient's injury. The first procedure that we use is called an algometric pain pressure threshold reading. What you see here is the actual algometer, and it's conducted by putting gentle increasing pressure on the injured area, and the patient tells us when the sensation has changed from pressure to pain. Now, what typically happens is because the area is injured, the pain threshold is lower because of inflammation and tissue damage. So they'll have a lower pressure pain threshold reading. As they get better or improve, you will find that reading increases. It takes more pressure to elicit pain. So it shows us, first of all, a lowered threshold of pain, and then subsequently a increased threshold of pain, which shows us an improvement. Now, this type of testing here, the pain pressure threshold, the Journal of Musculoskeletal Pain, basically says subjects with chronic WAD had significantly lower PPTs than asymptomatic subjects in both local and remote sites. There was a greater decrease of PPTs over cervical spine sites than either the upper or lower limb sites. So basically the research here is showing us that patients will have lowered pressure pain thresholds in the injured area. The next diagnostic procedure we use is called the Oswestry Low Back Pain Disability Questionnaire. This is the research here. Basically, it says that Oswestry Disability Index has become one of the principal condition-specific outcome measures used in the management of spinal disorders. Basically, what this is a series of questions regarding the activities of daily living of the individual and how they are affected by the injury. This here is a sample of the form that we use. Let me scroll up to the top. It actually has two parts. It has the neck disability and the low back, and so basically it's a series of questions. For instance, the pain intensity, I have no pain at the moment, to the pain is the worst imaginable at the moment. And it covers things as pain intensity, personal care, lifting, reading, headaches, concentration, work, driving, sleeping, recreation, and the patients will check off and rate these. They're also for the low back, pain intensity, personal care, lifting, walking, sitting, standing, and over here sleeping, sex life, social life, traveling, etc. So basically their scores are totaled, and you divide the scores by the total amount of points for each category and multiply it by 100 and gives you a percent disability. And then here's the interpretation. So for instance, moderate disability, severe disability. What this does, this allows us to document how this patient's injury has affected their daily life. We typically do this 3 times in their care. We do it initially when they come in, we do it about halfway through their care, and then we do it at the end of their care. And once again, according to Fairbanks in the study, this is proven to be a consistent, reliable way to document a patient's disability. So after the Oswestry, one of the things that we find is many patients come with headaches, dizziness, visual changes, sensitivity to light. Many of them actually suffer mild traumatic brain injury or concussions. And one of the survey questionnaires we use is the Rivermead Head Injury Follow-Up Questionnaire, and it's the Journal of Neurological, Neurosurgery, and Psychiatric. They basically state that the Rivermead Head Injury Form Follow-Up Questionnaire is a short, simple, adequately reliable, and valid measure of outcome across the entire range of severity, but particularly after mild to moderate head injury. This is crucial because most of the time, we don't see the severe head injuries because there's fractures and all that type of injury, but we see the mild to the moderate. They bumped their head, struck their head on a steering wheel, the dashboard, or just their head was whipped so violently that it caused a mild concussion to the brain. This River Mead is again, post-concussive symptom questionnaire, and again, the patients rate this. And there goes through a typical scoring process, and what it does is it helps us mark and monitor the potential for a mild traumatic brain injury. Along with the River Mead, when we have patients that have head injuries or seem to have head injuries, we also use the CDC's questionnaire. Now this here is the CDC fact book for physicians. Basically what I wanted to point out here is that the leading cause of MTBI is falls and motor vehicle trauma. All right, so the CDC recognizes that motor vehicle trauma can produce that. And when we look at some of the signs and symptoms, headache, nausea, vomiting, dizziness, fatigue, sensitivity to light, sensitivity to noise. The ones I've underlined here are ones that are very common that we see in our office. You'll also get those feeling mentally foggy, slowed down, difficulty concentrating, forgetful, and then some more emotional, and then sleep disturbances. So it's very common in our office to see people talk about they've got headaches, their dizziness, they're tired, light may hurt their eyes, or noises are bothering them, they feel foggy, they're kind of slow, lethargic. Some talk about sleeping, not sleeping well, sleeping too much, etc. These are all indicators, red flags for us that they might have an MTBI or a mild traumatic brain injury. So the CDC's form is called the Acute Concussive Evaluation Form. And basically this is filled out by the physician in conjunction with the patient. And we go through the process, and then we come down here, and between our initial intake form and our consultation, we go through and we answer these questions. And again, we document, are they experiencing them, and the severity of them. Depending on their previous history, if they've had a previous concussion or headache history, etc. We're then able to bring in this diagnosis of concussion without loss of consciousness, or actually with loss of consciousness, etc. And so basically what this does, this allows us to further document any possible mild concussion or mild traumatic brain injury. So these are some of the various procedures and forms that we use in our office to go above and beyond just the standard soft tissue sprain, strain, injury diagnosis. First of all, we want to make sure we're offering the quality care that the patients need. Second of all, we want to make sure that we are documenting the severity of their injury and the disability. What this does, this helps us offer the best quality of care for the patient, and ultimately helps them improve their life. So as I said, I'm Martin Schmaltz, and if you have any questions about these forms, don't hesitate to call my office, 314-731-4383. Hope you have a good day.